Paroxysmal nocturnal hemoglobinuria. It is caused due to the acquired mutation, the hematopoietic stem cells. So, this hematopoietic stem cells, when they acquire the mutations in the PIGA gene, these are named as PNH cells. As of the name, paroxysmal nocturnal hemoglobinuria cells. So, normally, the function of the PIGA gene is to produce a PIGA protein, which codes for GPI anchor. This GPI anchor is important to prevent the damage that can be caused due to the complement pathway. Normally, the complement pathway helps us fight the infections. But in case of complement pathway dysfunction, it can affect our own cells. It can cause the lysis of RBC in case of paroxysmal nocturnal hemoglobinuria. So let us see the mutated version of it. In case of mutations in the PIGA gene, there will be no PIGA protein formed. That means there will be no GPI anchor. What does that indicate? It causes the complement pathway dysfunction. It leads to complement mediated intravascular hemolysis, chronic spontaneous lysis of the RBC. So this PNH cells develop sensitivity to the complement mediated lysis. The word nocturnal is used here because at night when we sleep there will be hypoventilation. There will be more CO2 accumulated, leading to the respiratory acidosis. This high levels of carbon dioxide activates the complement pathway. In case of PNH cells, when the complement pathway is activated, the RBC lysis occurs. That means hemolysis. So this hemoglobin accumulate in the bladder overnight. So when they pass their first urine, it will be of dark brown color. Why? Because this hemoglobin in the acidic urine converted into acid hematin, which is of dark brown color. The first urine they pass will be the dark brown urine. As the day passes, the urine also reduces the color. Evening it comes to the normal regular color. So coming to clinical features, the intravascular hemolysis occurs and thrombosis can also occur. This thrombosis can affect the systems like renal system, cerebral system, hepatic system. So laboratory findings, you can see pancytopenia, anemia, leukopenia, thrombocytopenia, and in the increased levels of urobilinogen. Hemosiderin can also be seen as a renal complication. As a hepatic complication, urobilinogen also increased and hemoglobinuria is seen because intravascular hemolysis. So coming to diagnosis, the diagnostic test used for PNH is HAM test. It works on the principle like the RBC undergo lysis in acidified serum. For example, you can also see here, this hemoglobin is converted into hepatin in case of acidic urine. So this principle is used. So what we do, we take the RBC from the this patient and we subject it or incubate it in the acidified serum. So it undergoes destruction. So this is the HAM test, and this is how we know he's suffering from PNH. Sucrose hemolysis test is also positive in PNH. Flow cytometry is done to detect the abnormal RBCs. Treatment, stem cell transplantation, ravulizumab or the eculizumab can be given, and the underlying cause can also be treated like anemia, thrombotic complications should be treated.